Hello, this is Sharon Garrett. Today I'm going to present a short classroom activity that a nurse instructor can do for pre-licensure nurses that will meet one of the 6 QSEN competency areas. The objective for my classroom activity is that the students will develop skills of interacting with the diverse patients and be able to modify care aspects that are holistic. Students will progress in development of competency of patient-centered care by performing interactive case studies and critiquing them for improvement in a team approach. And as I mentioned, the QSEN for this competency is patient-centered care. And the definition of this from the QSEN.org is to recognize the patient or designee as the source of control and full partner in providing compassionate and coordinated care based on respect for the patient's preferences, values, and needs. So the classroom activity that I've developed is I have 2 sets of instructions. One is for the instructor and one is for the students. So I'll start with the instructor's instructions. The instructor would organize the students into groups of 3 or 4, and these groups will perform a simulation exercise. They'll be given a very short script by the instructor that the instructor's developed or obtained, and they will each play a part in a role play. Each scenario will have a patient, they'll have a nurse, and they'll have a family member. Some scenarios can have a 4th person added that could be an additional healthcare personnel, such as a therapist or a physician. But the purposes of what we're doing, I'm going to present a sample case scenario with 3 individuals. The interaction and the role play of the nurse will be ad-lib, and so that nurse will make responses. Those won't be scripted, but the other 2 characters will be scripted, and that way the instructor can sort of lead it in a direction. After the presentations are done and the students have met their objectives that they have defined in their instructions, then they will present an overall group presentation, and the instructor can lead an open dialogue on that, and hopefully then all the other classmates can learn from that. There won't be any grading or points assigned to this activity. So then the students' instructions are going to be that they will get their scenario from the instructor, they will practice their scenario, they'll follow the scenario script, and they'll identify ways that the nurse, who's the person ad-libbing in the responses, the only one ad-libbing in the responses, the nurse, they'll identify after it's completed what could that nurse maybe have done differently or improved upon to meet patient-centered goals. Each group then will, after they obtain necessary information that they would need to be able to better critique that, then they will go back and reenact it with their newly found education, and they will reenact that as a better improved scenario of how that could have gone. Again, and then afterwards they will go ahead and present that to the group, and the instructor can lead with some open dialogue there to allow for the learning outcomes for everybody. So I put together just a sample to kind of pull this together so people understand. And just to say that this is a Hispanic American cultural case scenario that I've put together. And the following case scenario is not to imply that each person in this cultural group has the same beliefs. These are just general trends within the cultural group. So the case scenario I wrote is Mr. Reynosa, a 72-year-old Hispanic American, is admitted to the long-term care facility for rehab following a CVA. He has right-sided weakness and speech is slightly slurred. He is alert and oriented. His daughter is present at the bedside and has been actively involved providing care for her father. Small religious artifacts are noted around the room. Mr. Reynosa speaks English, but Spanish is his primary language. The nurse enters the room to discuss with Mr. Reynosa the schedule for today's rehab. As the nurse enters the room, she sees that the daughter is feeding Mr. Reynosa his breakfast, and the scene opens with the nurse entering the room. So then the nurse would, be prompted for a greeting. Mr. Reynosa would respond, "Good morning." The nurse then is prompted to discuss the medication and the rehab schedule for the day. Again, she can ad-lib that, but there is a note here that rehab is for 10 a.m. The daughter then states, "My father wants to go to the Catholic service they have here in the morning, at 9:30, so he won't be able to go to rehab. And the nurse will need to respond to this. Mr. Reynosa then says, "Daughter, can you get me a drink?" And the daughter gets up and gets him a drink and assists him with the drink. And the nurse then is prompted to ask him about his pain. Mr. Reynosa says, "Daughter, I don't know what she's talking about. What does she mean?" And the daughter says, "She wants to know about your pain, but I would say his pain is at a level 4, she tells the nurse. So the nurse must respond to this. So the nurse completes the discussion and exits the room, but does ask if the daughter could come to the hall for a moment. The daughter comes to the hall and says, "You wanted to see me?" And the nurse says, "Yes, I wanted to talk about your father's rehabilitation goals. It is important that he is doing things that he can, like eating for himself." The daughter becomes upset and says, "I don't understand," and the scene closes. So that last part for the nurse is scripted so that we can put it in the direction that we want, but the rest was something that individual doing the role play needed to respond to. So now the students are going to be asked to identify, first of all, what culture is, what cultural values are, and then they need to, utilize their computers, or they'll have time to research what are some of the Hispanic American cultural beliefs in relation to health practices. So I've put a few of these together, such as they have a strong belief in paternalism. The male would be the main decision maker, the lead decision maker. The woman is sacred in the heart of the household, highly revered. Elders are respected and leaders of the family. Families depend on each other, not outside help. They do expect to be pampered when ill. It's a sign of love from the family. They have a holistic view of healing that involves their religious beliefs, and they respect privacy and modesty. So now, after they research that and gain that knowledge about that particular culture, they can go back and apply different responses that might have been better patient-centered for that particular case scenario. And then some questions are here to help lead them in the direction. Was the nurse aware that many Hispanic families have strong interdependence upon one another, especially children to the parents? What might the nurse discuss with this family member to be respectful of the culture, but allow Mr. Reynosa to meet rehab goals so that he will be able to return home? What options for assessing pain could have been employed so that the resident is the one scoring the pain? And religion is obviously a very important part of Mr. Reynosa's life, and did the nurse respect this and alter his rehab schedule for him? So this is a classroom activity that I put together to meet the QSEN objective of patient-centered care. This could be written and modified and adapted for any scenario, and all the classmates in the class would be able to learn from that, and it would be interactive and not just reading a case study off a piece of paper and then writing out a response. Thank you for your time.